Hello, everyone. My name is Nario Cantu, and thank you for tuning in for the Friendly Pharmacist podcast, starting now. Hi, everyone. I'm Nario Cantu, pharmacist and owner of Cantu's Pharmacy, and welcome back to the Friendly Pharmacist podcast. Today, we're going to have a little fun while tackling something really important, pharmacy myths. Every day, I hear misconceptions about vaccines, supplements, antibiotics, compounding, and even basic pharmacy practices. These myths spread quickly, especially online, and they can lead people to make choices that aren't safe or effective. So today, I want to break down some of the most common myths and give you clear, trustworthy information you can feel confident about. Let's start with one of the biggest myths out there. Vaccines make you sick. This one has been around forever, and it's simply not true. Vaccines don't give you the disease they're protecting you from. For example, the flu shot cannot give you the flu. It uses inactivated virus, which means it can't replicate in your body. What you may feel after a vaccine is your immune system waking up. Things like a sore arm, mild fatigue, or a low-grade fever. These are normal and usually short-lived. They're signs that your body is building protection. The real risk comes from skipping vaccines, not getting them. Another popular myth is all supplements are safe because they're natural. Natural doesn't always mean harmless. Some supplements can interfere with medications, cause side effects, or even harm your liver or kidneys if used incorrectly. For example, St. John's wort can interfere with antidepressants and birth control. High-dose vitamin E can increase bleeding risk. And some supplements have interactions that people don't discover until they experience a problem. Supplements can be helpful when used appropriately, but they're not one-size-fits-all. This is why talking with your pharmacist is so important. We can help you choose products that are safe, effective, and appropriate for your health goals. Let's move on to antibiotics, another source of confusion. One common myth is antibiotics work for colds and viruses. They don't. Antibiotics kill bacteria, not viruses. Taking antibiotics for viral illnesses not only won't help, but it can also lead to antibiotic resistance, meaning the medication may not work when you actually need it. Resistance is a real issue, and it's one of the biggest public health challenges of our time. If your doctor or pharmacist tells you that an antibiotic isn't necessary, it's because it won't help, not because we're trying to withhold anything from you. Now let's talk about compounding pharmacies because there are plenty of myths here too. One common misconception is compounded medications aren't safe or regulated. In reality, compounding pharmacies follow strict guidelines to prepare custom medications that meet specific patient needs, like when a patient is allergic to an ingredient in a commercial product, or when a medication comes only in a form or a strength that isn't suitable. Compounding is an essential part of pharmacy practice, especially for pediatrics, dermatology, hormone therapy, and veterinary care. While compounded medications aren't mass-produced like commercial drugs, reputable compounding pharmacies follow rigorous standards to ensure quality and safety. And in many situations, compounding is the only way to get exactly what the patient needs. Another myth I hear is generic medications aren't as good as brand name drugs. I addressed this in another episode, but here's the short answer. Generics have the same active ingredients and work the same way as brand name medications. They go through strict FDA approval processes to ensure bioequivalence. The main difference is cost. Generics are less expensive because manufacturers don't have to repeat years of research. Over 90% of prescriptions in the U.S. are filled with generics because they're safe, effective, and affordable. Finally, let's bust a myth about pharmacists ourselves. Pharmacists just count pills. Trust me, if that's all we did, the profession would look very different. Pharmacists are medication experts. We review interactions, adjust dosages, catch prescribing errors, counsel patients, coordinate care with doctors, administer vaccines, monitor chronic conditions, and provide education that directly impacts patient safety. Most people don't realize how many problems pharmacists prevent simply by reviewing your medications before you take them. Myths can be powerful, especially when they play on fear or confusion. But good information is even more powerful. The truth is that pharmacy is a science-driven field with one focus: keeping you safe and helping you stay healthy. If you ever hear something that doesn't sound quite right, or if you're unsure whether a claim online is factual, come talk to your local pharmacist. We're here to be a reliable resource in a world full of noise. Thank you for joining me for this myth-busting episode of the Friendly Pharmacist Podcast. I'm Nario Cantu, and I hope this helped you feel more confident in navigating medications, vaccines, supplements, and pharmacy services. If you enjoyed this conversation, be sure to follow, share, and tune in for more friendly, practical health guidance. Until next time, stay curious, stay informed, and never hesitate to ask questions.